All right, let's dive into Medicare. Specifically, this Medicare and You 2025 handbook. I know, it can seem a little intimidating, but trust me, after this deep dive, you'll be navigating Medicare like a pro.
That's true.
And get this, 2025 is bringing some pretty big changes, changes that could actually save you some serious money, especially when it comes to prescription drugs.
Absolutely.
We're talking a $2,000 out-of-pocket cap on drug costs, and even a new option to spread those costs out in monthly payments.
That's a big one.
Pretty neat, huh?
Yeah, this handbook is really like your guide, your personalized guide to making the most of your Medicare benefits.
That's a great way to put it. So before we get lost in all the details, let's just start with a quick overview of the whole Medicare landscape. I'm sure you've heard all these terms thrown around, Part A, Part B, Part C, and Part D, but we're going to break it down for you.
Exactly. Think of it this way. Part A, that's your hospital insurance. It covers things like inpatient care, skilled nursing facilities, and hospice. Part B, on the other hand, is your medical insurance. That takes care of your doctor's visits, outpatient services, and those preventative screenings.
Right. And then things get interesting with Part C. That's also known as Medicare Advantage. And that's kind of like an alternative to original Medicare, which is your Part A and Part B. These are plans that are actually offered by private insurance companies. And they often come with these extra perks, like, vision, dental, or hearing coverage.
Yes, and finally there's Part D. And that one covers all your prescription drugs.
Which we'll definitely dive deep into a bit later, especially with those big changes I mentioned for 2025.
We'll definitely get to that.
Yeah, and the handbook does a really good job of highlighting the key differences between all these options. And they actually use these handy little symbols to guide you.
They do.
But remember, there's really no one-size-fits-all solution when it comes to Medicare. The goal here is to help you find the coverage that really perfectly suits your needs, your individual needs.
Exactly. It's all about empowering you to make those informed decisions about your healthcare.
Right. So let's move on to actually enrolling, the enrollment process. So if you're already receiving, let's say, Social Security benefits or Railroad Retirement Board benefits, you're in luck because Part A and Part B coverage, that kicks in automatically when you turn 65.
That's right. But for anyone who isn't receiving those benefits yet, you'll need to manually sign up for Medicare. And here's a really important point. The handbook, it really stresses these potential penalties for late enrollment for both Part A and Part B.
So don't procrastinate.
Exactly.
Get that paperwork in on time. And just a quick heads up, for anyone living in Puerto Rico, Part B enrollment there, that's always manual, even if you are receiving Social Security benefits.
It's one of those little details that people can sometimes miss.
Absolutely. And, things can get kind of tricky when we start factoring in other insurance coverage you might already have. Like, do you have employer-sponsored insurance, a retiree plan, COBRA, TRICARE?
Yeah, figuring out which insurance pays first, that can be a real puzzle. But the handbook does a really good job of explaining it, this whole concept of primary and secondary payers.
Right. So, for instance, let's say you're over 65, you're still working, and your employer has, let's say, over 20 employees. In that case, your employer coverage would actually be the primary payer, and Medicare would step in as secondary. But if your employer has fewer than 20 employees, then Medicare becomes the primary.
That's right. And here's a pro tip straight from the handbook. If you're switching over to Medicare from a marketplace plan, make sure you end that marketplace coverage right away to avoid those premium penalties later on.
Good advice. All right, let's get into the nitty-gritty of Part A and Part B. Part A, that's your hospital insurance, so that covers your inpatient care, skilled nursing facility care, hospice care, and some home health care. And while most people don't actually pay a monthly premium for Part A, there is a deductible to keep in mind.
Yeah, in 2024, that Part A deductible is over $1,600. But here's where it gets interesting. Let's say you're in a skilled nursing facility and you disagree with your discharge. You feel like you still need that level of care.
Oh.
You actually have the right to appeal that decision.
Really?
Yes. The handbook walks you through that whole process so you don't feel powerless in those situations.
I like that. Okay, so now on to Part B, your medical insurance. That covers a much wider range of services, like your doctor's visits, outpatient care, preventive screenings, and even some durable medical equipment.
Right. With Part B, you'll have a monthly premium, which is $174.70 in 2024, and an annual deductible of $240.
Okay, and here's a really important point to remember about original Medicare. There's no annual limit on what you could end up paying out of pocket. So those unexpected medical expenses, they could really add up.
Unless you have supplemental coverage. like a Medigap policy, which we'll talk about in detail later.
Okay.
But before we move on, there's one more important concept to grasp. Assignment.
Assignments.
Yes. Assignment basically means your doctor or provider agrees to accept the Medicare-approved amount as full payment for their services. And this is key because it directly impacts your out-of-pocket costs.
Oh, I see.
So, if your provider accepts assignment, you'll generally pay less, typically just your deductible and co-insurance. But if they don't accept assignment, things can get a bit more complicated. You might end up paying the full charge up front and then wait for Medicare to reimburse you.
Yeah, that doesn't sound fun.
Definitely not.
So always double check if your providers accept assignment before you get any services.
It's a good tip.
All right. Are you ready to explore a whole different approach to Medicare? Medicare Advantage or Part C?
This is where things get really interesting. With plans that offer more flexibility, and often they include extra benefits.
Yeah, it's like choosing the deluxe package for your health care. But there are so many different types of Medicare Advantage plans. It's important to understand how they all work to make the right choice.
Absolutely.
So we're talking HMOs, PPOs, PFFS plans, SNPs, even MSAs.
We'll break them all down.
Don't worry.
We'll break them all down in part 2 of this deep dive so you can navigate these options confidently.
Okay, sounds good. But for now, the key takeaway is that Medicare Advantage plans, they really give you more control over your healthcare experience, often with added benefits and potentially even lower costs.
That's right.
However, they do come with some trade-offs, such as network restrictions and, sometimes needing referrals to see specialists.
It's about weighing the pros and cons and figuring out what really aligns best with your healthcare preferences and your budget.
That's exactly. Welcome back to our Medicare Deep Dive. We're still unpacking this Medicare in You 2025 handbook, your roadmap to, understanding and maximizing your Medicare benefits.
And in the last part, we covered, just the foundations of Medicare, like the different parts, signing up, and how it works with, any other coverage you might have.
Right now, I think it's time to zoom in on those Medicare Advantage plans, or as the handbook calls them, Part C. They're like the customizable option for Medicare, offering an alternative to original Medicare.
Part A and B.
Exactly. And their popularity, it's really soaring.
Yeah, it's no surprise, though. You get extra benefits like vision, dental, hearing, stuff that original Medicare doesn't usually cover.
It's like a bonus package with your healthcare.
Yeah.
But before you jump in, you got to remember that Medicare Advantage, it comes in a lot of different, flavors.
It does.
The handbook does a good job of explaining the differences. But understanding those nuances, that's crucial for picking the right plan for you.
Absolutely. So let's break down these different types of Medicare Advantage plans, starting with HMOs, health maintenance organizations.
HMOs, those are known for having lower premiums, right? And lower out-of-pocket costs.
They are, which is appealing.
Definitely. But there's got to be a trade-off.
Well, yeah. With an HMO, you're usually restricted to using doctors and hospitals within the plan's network. It's like a curated group of providers chosen by the plan.
Okay.
And you'll probably need referrals from your primary care physician to see any specialists.
So if you really value freedom of choice when it comes to your doctors, an HMO, maybe not the best fit.
Yeah, that's a good point. Now, if you're really after flexibility, let's talk PPOs, preferred provider organizations.
Yeah, PPOs, those offer more freedom, right?
They do. More freedom in choosing your providers. You can even see doctors and hospitals outside of the plan's network, but it might cost you more.
So, like having the option to go off menu at a restaurant.
Exactly. All right, now let's move on to a less common type, private fee-for-service, or PFFS.
PFFS plans, those are interesting. You can see any Medicare-approved doctor or hospital, as long as they agree to treat you.
Right.
Sounds pretty flexible.
It does. But there is a catch. Providers, they aren't required to accept the plan's payment terms, so you might end up negotiating prices directly with them.
Ooh, that sounds a little more complex than the other options.
It can be, especially if you prefer, a more predictable healthcare experience.
Right.
Now, for people with specific health needs, there are special needs plans, or SNPs.
Okay, SNPs.
These are designed for people with chronic illnesses or certain conditions. They offer tailored benefits and care coordination to really meet those unique needs.
Like SNPs specifically for people with diabetes or heart failure.
Exactly, or even those who are dual eligible for both Medicare and Medicaid.
Right.
These plans really focus on providing that comprehensive care for folks with more, complex health situations.
Makes sense. And lastly, we have those medical savings account plans, MSAs. These are pretty different from all the other options.
Yeah, they are. MSAs, they combine a high-deductible health plan with a tax-advantaged savings account. The idea is you use the money in that savings account to pay for your healthcare expenses until you hit your deductible.
So MSAs, they're ideal for people who are comfortable, managing their own healthcare spending and prefer those lower monthly premiums.
Exactly. They offer more financial control, but they also come with higher upfront costs.
Right. So as you can see, there's a lot to consider. When you're choosing a Medicare Advantage plan,
There is.
it's like picking out a car. You want the model with the features that fit your needs.
That's a great way to put it.
And don't forget, the handbook actually has a chart that compares the different Medicare Advantage plans side by side.
It does.
So you can see the costs, the benefits, the restrictions.
All at a glance.
It's like a cheat sheet.
It is. And if you're still feeling a little lost, your state health insurance assistance program, or SHPHR, they can provide personalized guidance.
Oh.
They're like your personal Medicare navigators.
I like that. Yeah. All right, let's switch gears a bit and talk about Medigap, those supplemental insurance policies. That can help fill the gaps left by original Medicare coverage. We touched on these briefly before, but now let's dive a little deeper.
Okay, so one of the great things about Medigap policies is that they're standardized, meaning Plan A will offer the same basic benefits, no matter which insurance company you buy it from,
Okay.
and so on, for plans B, D, G, and so forth.
Wait, didn't we say that some plans like C and F, they aren't available anymore?
That's right. If you became eligible for Medicare after January 1st, 2020, Plan C and F, they're off the table.
Oh, okay.
Those plans used to be really popular because they covered the Part B deductible. But because of, rising healthcare costs, they became less sustainable for insurance companies.
So what are the options now for people who are new to Medicare?
Well, Plans D and G, those are the go-to options now for coverage that's similar to what Plan C and F used to offer. And it's important to remember that Medigap policies, they only work with original Medicare. If you choose a Medicare Advantage plan, you won't need a Medigap policy.
It's like choosing between two different paths. You either go the original Medicare route with the Medigap supplement, or you choose that all-inclusive Medicare Advantage route.
Exactly. Now let's talk about choosing the right Medigap plan for you.
Sure.
The handbook is really helpful here. It's got a chart that compares the different Medigap plans side by side.
Right.
It breaks down which plans cover what benefits, and it outlines those potential out-of-pocket costs.
I like that.
You can see at a glance which plans cover. Part A, coinsurance. Part B, coinsurance. Skilled nursing facility coinsurance, even foreign travel emergency care.
It really is like a cheat sheet.
It is. Now, remember that Medigap open enrollment period we mentioned before?
The 6-month window?
Right, starting the month you turn 65. And enroll in Part B.
Right.
That's your golden ticket to buy any Medigap policy you want without being denied coverage or charged higher premiums because of your health history.
So important.
Don't miss that opportunity to lock in coverage at the best possible rates. Because after that period, it can be a lot harder to get a Medigap policy, especially if you have pre-existing conditions.
So if you're even thinking about a Medigap policy, mark that open enrollment period on your calendar.
Yes.
All right, so we've covered a lot of ground on Medicare Advantage and Medigap, two very different approaches to enhancing your Medicare coverage.
Right. Next up, we'll delve into the world of prescription drug plans, Part D. Get ready to learn about those game-changing updates coming in 2025. Including that $2,000 out-of-pocket cap on drug costs and the new Medicare prescription payment plan.
All right, welcome back to the Deep Dive. We're wrapping up our exploration of Medicare and You 2025, and I'm pretty excited for this part. We're finally talking about prescription drug coverage.
Yes, Medicare Part D. It can seem a little overwhelming, but don't worry, we'll break it all down. Especially with these big changes coming in 2025, they could really impact your budget.
You're talking about that $2,000 out-of-pocket cap, right? That's a big deal. No matter how expensive your medications are, you won't pay more than $2,000 out of pocket for the entire year.
That's right. It's a game changer, especially for those folks who rely on those really pricey medications for chronic conditions. Things like rheumatoid arthritis, multiple sclerosis, or even certain cancers.
Wow. They could potentially save thousands of dollars.
They could.
That's incredible.
Yeah.
And then there's that Medicare prescription payment plan. I like that one too.
Oh, yeah.
It's like having a budgeting tool for your meds.
Exactly. It lets you spread those drug costs out over monthly payments instead of, getting hit with the big bill all at once at the pharmacy.
So no more surprises or scrambling to cover those costs, just predictable, manageable monthly payments. I like that.
Predictability and peace of mind.
Okay, so let's back up a little. How does Part D actually work?
Okay, so first, you choose a plan from a private insurance company. Each plan has its own list of covered drugs. That's called a formulary.
So it's kind of like a menu of medications. And just like with a restaurant menu, some options are going to be pricier than others.
That's right. A lot of formularies use a tiered system, so different co-payments or co-insurance amounts for drugs in different tiers. Lower tiers usually mean lower costs, and higher tiers, well, higher costs.
So it's good to know what tier your meds fall into.
Absolutely. And here's a little something to keep in mind. If your doctor prescribes a drug that's not on your plan's formulary, you might have to pay the full price.
Unless you can get an exception.
Right. The handbook explains how to request those exceptions, especially if that non-formulary drug is medically necessary.
Good to know.
Yeah, and it's also worth noting that plans can actually change their formularies throughout the year, so you really want to review your plan's formulary annually, just to make sure it still covers your medications. If not, you can switch plans during the open enrollment period.
It's like a game of strategy, but with your medications.
It is.
Okay, so how can people be savvy players and save money on their Part D coverage?
Well, one simple strategy is to just use generic drugs whenever possible. They have the same active ingredients as those brand name drugs, but they're often much cheaper.
Makes sense.
And talk to your doctor about, lower cost alternatives. They might know of equally effective medications that are just more affordable.
Good point. And what about mail order pharmacies? Do those usually offer discounts?
They do. They often offer discounts if you order a 90-day supply.
That's a good tip. Saves money and trips to the pharmacy. Now, the handbook also mentions some safety features built into Part D, like those opioid management programs.
Right. Those are really important, especially for addressing the opioid crisis and keeping patients safe.
Yeah, definitely.
They involve things like safety checks at the pharmacy and limits on how many opioids can be prescribed.
All about striking that balance. Effective pain management, but preventing misuse.
Exactly.
Now, we can't forget about those who might need a little extra help affording their Medicare costs. The handbook talks about those financial assistance programs, Medicare savings programs, and extra help.
Right. Those can be a lifesaver. Medicare savings programs, those can help pay for your Part B premiums, deductibles, coinsurance, and extra help can help with Part D premiums, deductibles, and copayments.
So if you're struggling to make ends meet, definitely look into those.
Absolutely. The handbook even has the contact info for your state's Medicaid office. That's where you'd inquire about eligibility and how to apply.
Okay, good to know. And as always, knowledge is power.
It really is.
Especially when it comes to healthcare. The handbook really emphasizes those Medicare rights and protections.
You have the right to appeal coverage decisions, report fraud, access your health information.
It's all about having a voice, and the handbook empowers you to use it.
It does.
All right, so we've covered a lot of ground in this deep dive into Medicare, understanding the different parts, exploring Medicare Advantage, Medigap, and Part D. There's a lot to take in.
There is. But remember, the Medicare and You 2025 handbook, it's your go-to for all things Medicare.
Don't let it just sit on the shelf. Use it. Explore it. Highlight important things. Refer back to it whenever you have questions.
It's like your personal Medicare guru,
guiding you to the coverage that's best for you.
We hope this deep dive has left you feeling a little more confident about navigating Medicare, especially with all those changes coming in 2025. Remember, knowledge is power. And with the right information, you can really take control of your healthcare.
And make the most of your Medicare benefits. Well, that about wraps up this deep dive.
Until next time, stay informed, stay empowered, and good luck navigating the world of Medicare.